Like other parts of the world, COVID-19 poses a huge challenge for Pakistan. The first case of COVID-19 was reported on the 26th of February in the country. Since then, the country has shown an upward trend in the recorded cases, posing an enormous challenge to the health services in Pakistan. Following the Global Polio Eradication Initiative guidelines, all polio campaigns in Pakistan have been suspended. Under the guidance of the Ministry of National Health Services, Regulations and Coordination, polio programs as infrastructure and key services, including surveillance, data, and communication, have been assigned to support COVID-19 response since March 2020.
We made a consensus decision to put all our energies, efforts, assets, capacities in support of the government's COVID surveillance and response effort all across Pakistan. We are very active part of the National Command and Control System, which has been established in Pakistan. The information that our people send us in real-time basis, and then the great analysis that is done by our epidemiologist over here, that is the backbone of decision-making at the national level. In the absence of having an established surveillance system for communicable disease in Pakistan, how difficult it was to come up with a very robust COVID surveillance that Pakistan did very quickly in short span of time. That was only possible because of the hard work and commitment of everybody in this program.
10,536 reporting sites all over the country are now providing information on suspected COVID-19 cases. Polio team trained over 50,388 health sector professionals and workers belonging to all tiers of the health system on COVID-19 preparedness and response. Trained approximately 4,639 community influencers now engaged in community-based surveillance, reaching people with information and support.
Contributions that our communications teams made because of their understanding of the social assessment of particularly most deprived populations in Pakistan. Similarly, utilizing their relationship with the communities, using their relations with the influencers, with the religious spokespersons to raise the awareness, to tell the people what they need to do, what are the critical instructions of the health authorities that they need to follow in order to prevent the spread of this virus transmission in the communities. I think one great contribution that again our comms team made and particularly our the religious spokesperson made was really coming up very openly to tell the communities that what are the hazards of having gatherings in the mosque, particularly during Ramadan.
जब से ये एक्टिविटी स्टार्ट हुई है तो हमारे जितने भी ऐसे बिजी पॉइंट्स है या क्राउडेड एरियाज़ है जहाँ पे सेफ्टी प्रिकॉशंस को या सोशल डिस्टेंसिंग को फॉलो नहीं किया जाता था, तो थ्रू दिस मोबाइल फ्लोट एक्टिविटी, रिक्शा अनाउंसमेंट्स, एक अच्छा रिस्पांस हमें वहाँ से कम्युनिटी से मिला है इन टर्म्स ऑफ सोशल डिस्टेंसिंग.
The Sehat Tahaffuz 1166 toll-free helpline, which supports polio and routine immunization, has been co-opted to support COVID-19 response. 250 helpline agents and 16 doctors are working 7 days a week at the helpline, providing right information and connecting people across the country. The social media team of Polio Program has been proactively reaching out via the social media channels and WhatsApp groups, reached more than 23 million people with accurate messages, actively helping to dispel COVID-19 related misinformation. It has engaged celebrities, sportsmen, religious leaders, bloggers, journalists, and local influencers to spread COVID-19 related awareness messages, especially on personal hygiene and physical distancing. The partnership with the Pakistan Cricket Board was instrumental to engage celebrity cricketers for disseminating messages. Also, partnership with Pakistan's leading online retailer store, Daruz.pk, and many other commercial entities, including restaurants, helped to disseminate COVID-19 awareness messages widely. The polio eradication program procured relevant personal protective equipment supplies and delivered them to all field officers engaged in surveillance activities. In addition, hand sanitizers, masks, and gloves have been procured and distributed among the frontline health staff to ensure their safety in the line of duty.
Let me thank all partners and donors for their consistent support to Pakistan, not only for polio eradication, but also as this COVID challenge emerged for being with us and fully supporting us in terms of our team decision to support the national efforts for COVID response.
During these difficult times, the polio eradication team is standing strong with the community, providing much needed support at various fronts, and will continue with the same zeal and precision. We are together to fight against COVID-19.